I've never done a termination, and I never will. I'm a very lucky person to be a practicing obstetrician in Ireland. I'm proud to be Irish, and I would hate to see Irish society excise Down syndrome, the disabled, where Ireland has historically been there for the oppressed, been there for the vulnerable, and to excise these beautiful people from our society is weakening the Irish genome. I want to reassure people, Irish obstetrics is safe. It's the best in the world. Consultants are very well trained, talented people. We've got compassionate midwives. We love our speciality. And this tsunami of abortion saddens me greatly. But Ireland's safe. This is confidential maternal death inquiry in Ireland. Dr. Michael O'Hare has publicly and published that Ireland is safe. So the data is anonymised. So it's collected post-mortem clinical notes from midwives, obstetricians, anaesthetists, and all the other specialities. It goes to Embris UK. They're all reviewed by the various specialities, collected, collated, and then the chapters are written. So, maternal death. Maternal deaths of women while pregnant within 42 days of the end of pregnancy from any cause related to aggravated by pregnancy or its management, but not from accidental or incidental causes. So direct, this is the litmus paper for how we perform in labour ward. So deaths resulting from obstetric complications of the pregnant state, labour, puerperium, interventions, omissions, incorrect treatment, or a chain of events. You know, the Swiss cheese we talk about, where you have various things like the blood bottle not being labelled, the porter not turning up in time. Things fall into place and then a tragic event happens. Indirect deaths are resulting from pre-existing disease or disease that developed during pregnancy, which is not the result of the direct obstetric causes, which is aggravated by the physiological effects of pregnancy. So patients with cardiac issues, diabetic arteriopaths. Late, these are deaths that occur between 42 days and a year after pregnancy and result of direct or indirect maternal causes. So these would include the suicides. Coincidental, deaths from unrelated causes which happen to occur in pregnancy or the puerperium, such as cancer. So this is the gold standard. This is how we rate ourselves, and as you can see, small fluctuations can have quite a deviation of the graph, but Ireland is holding its own. We must remember, in our grandparents' time, babies died, mothers died. We didn't have blood transfusions, we didn't have antibiotics. We have all these new tools to make pregnancy a safe place. So taking into account the relatively small numbers of maternal deaths in Ireland, fluctuation in the rate is inevitable and it must be interpreted with caution. So the MMR in Ireland was 6.5 per 100,000 and the rates in 2011 were respectively 10.4 and 9.8. So there's no clustering in any one maternity hospital. So as we have here, we've got a graph showing maternal deaths, direct and indirect. So the cardiac disease was the commonest cause of death in Ireland, maternal death. And this is probably because we have greater surgery in paediatric surgery, greater positive results, and they're actually surviving to have children. So the 9 maternal deaths were due to cardiac disease, myocardial infarction, cardiac arrest, and neurological disease, epilepsy. And that's just a summation of the graph. So the 4 maternal deaths due to direct causes, so this is attributing how we perform in labour ward, are thromboembolism. Being pregnant with Virchow's triad makes you proclot, makes you thrombogenic. Preeclampsia, which is peculiar to pregnancy. Amniotic fluid embolism, which is quite rare, thankfully. And early pregnant complication with sepsis. and that's the graph regarding that. As you can see, there has been some genital tract sepsis. There has also been a number of H1N1 flus which have caused maternal deaths. So maternal suicide was the leading cause of direct maternal deaths occurring between 6 weeks and 1 year after pregnancy. 2 maternal deaths in 2013 and 2015 were attributed to coincidental causes. Both deaths were due to malignancy. The 7 late deaths were reported between 2013 and 2015. 4 were suicide, and they were at home. 1 was thromboembolism, and 2 were attributed to indirect causes. They also analysed at what state, whether antenatally or postpartum was the clustering of maternal deaths, together whether the location. The 4 being at home was suicide. They looked at BMI, they looked at smoking and parity, and they found the greater parity, the greater BMI, and ethnicity can actually increase your chance of maternal death. So mortality also increases with advancing maternal age. Ethnicity is an unusual one, I suppose, because it may be problematic in given a history, the support mechanisms. So the take-home message: cardiac disease was the largest single cause of maternal deaths. The significantly higher rate of indirect compared with direct highlights the ongoing changes in maternity services and caring for women. Suicide now is classified as the direct maternal death. Thromboembolism remains a leading cause. Further evidence of increased maternal mortality in association with increased maternal age is a concern, taking into account current trend in Ireland towards increasing age in pregnancy and childbirth. Thank you.